Hi everyone, I am Miriam Smith, nurse educator. Today's episode covers therapeutic communication. Last week we started and we'll continue today. The areas we'll dealing with is we're going to be addressing accepting, we're going to be addressing offering of ourselves, and also seeking clarification. Now, as an experienced nurse for many years, going into the hospital, we meet so many different type of patients. We'll say diverse population, whether it's education, whether it's race, whether it's language, just different problems, different diseases, concerns. But to help the patient cope in these settings, the nurse must be able to communicate clearly to the patient. And so today we'll be addressing acceptance, accepting the patient. Some patients will be telling you about themselves and they'll disclose so much information. And they're observing you to find out if you're showing any interest. And so they will talk and talk and talk. And how do they observe that you are following them? You're nonverbal, or you might be able to say something, but your nonverbal says a lot. Because you can be saying something else and mean something else. The patient is observing you. And as you listen, you can support the patient by nodding their head or so forth. Nodding your head non-verbally, communicating with your body language, they see. And that actually telling you that you are, the patient is, you're supporting that patient at the time. So that's crucial, showing acceptance and being non-judgmental as you care for the patient, as you glean information so that you can give the appropriate care to that patient. Now, another way of providing therapeutic communication is by offering of yourself. How is that done? Well, hospital can be very challenging at times. Patient can be very lonely, although other patients are passing or other nurses are passing. And just that little extra time because of your observation to say a word to that patient. Maybe sitting for a minute or two and just listen to the patient. Offering of yourself. The patient sees that somebody cares to spend a little extra time with him or her. So that is offering of self, and patients need that. Many times some of the elderly or a little one, whoever it is, from your observation, you can offer yourself, and that will make a big difference because the patient will be able to relate to you and give information that if you had not sat there with that patient, you wouldn't have received such information, which might be very vital in the care of that patient. So remember also, as a young nurse, spend a little extra time, and develop that relationship in order to give the quality care that the patient needs. And my last technique for today will be seeking clarification. As you know, we have patients of diverse illnesses, languages, and so forth. And so sometimes, as patients communicate, there's some barriers sometimes that they encounter, that they experience. And so patients will say like, I've had this experience. Patients say, my tummy aches or my chest aches, and they're using the two words interchangeably. Now, as a prudent nurse, or as a nurse that's becoming wiser and gaining more experience, the nurse might be able to say, I'm not sure I understand you, or can you explain, or can you touch the area? Because some patients might be saying, here's my chest, here is my abdomen, or you're showing lower down, that's the chest. So they're a little confused, when there's ambiguity or something that's not clear, you can ask them to explain. You can ask them to touch and so forth. And that will make a big difference. And there might be even some humor sometimes as you interact with your patients when it comes to identifying what type of pain, where is the area that's really that's in question right now. And so you'll as a nurse, as you grow, you will experience some of these situations that we older ones have encountered many times. But it goes with experience. So remember today that as you offer therapeutic care, in order to ensure that the patient receive the appropriate care that's needed, it's important to remember to accept your patient for who they are. Also,